What's up, people? Dr. Ray Vitger, Vet Triage. It is 1:55 p.m. Pacific Time, Tuesday, October 22nd. We are going through this issue of JAVMA, which is from January 15, 2016. And we're going to be talking about this study out of Denmark, the integration of a physical training program and a weight loss plan for overweight pet dogs. These studies are great. I love weight loss studies. They're hard to do, and we need more of them. So the objective is to investigate whether a controlled physical training plan for overweight dogs during a weight loss program would improve cardiovascular fitness and preserve lean body mass, compared with the results of dogs that are in a weight loss program based on caloric restriction alone. And they said all dogs were fed the same calorie restricted diet, rationed to achieve a weight loss rate of 1 to 2% per week for 12 weeks in a row. The fitness group underwent underwater and land-based treadmill exercises 3 times a week, whereas the diet-only group only received the diet and did not receive any additional exercise beyond what they normally did on a day-to-day basis. Results: the mean weight loss was 13.9% for the fitness dogs and 12.9% for the diet-only dogs. The mean accelerometer counts during the intervention were 13% higher than baseline for the fitness dogs. The heart rate during the exercise declined after intervention, but in both groups of dogs. The lean body mass was preserved in the fitness group and lost in the diet-only group. Conclusion is the controlled exercise plan used with a dietary weight loss program prevents loss of lean body mass in dogs. So this supports the inclusion of physical training in controlled measures for obesity management in canines. So let's go into the introduction. Overweight and obese dogs have a shorter lifespan, reduced quality of life, increased risk of diseases that includes cancer and arthritis, insulin resistance, high lipid counts, chronic low-grade inflammation. And the study used pedometry, which measures the number of steps taken, and accelerometers, which assesses the movement of dogs. In one study, overweight dogs did not spontaneously increase their physical activity during a 6-month weight loss program, despite successful weight loss, saying that if you have your dogs in a weight loss program, it doesn't mean that their activity level goes up. It actually doesn't. Weight loss usually results in loss of both fat and lean body muscle. Factors affecting lean body mass loss during canine weight loss programs include protein content in the diet and the rate that you have them lose the weight. A high protein diet is reported to reduce the loss of lean body mass in dogs to a ratio of 15 to 20% of the total loss. This is compared with 30% when you only use a moderate protein diet. In people, studies have shown that the loss of lean body mass can be prevented if you're eating a low-calorie, high-protein diet in combination with physical exercise. Preservation of lean body mass is preferred because it preserves energy requirements and physical strength. Thereby, the achieved weight loss is easier to maintain than achieved by dietary changes alone. Thumbs up. I agree. All right, so materials and methods. They use medium to large breed dogs. The dogs had a body condition score of at least 6 out of a 9-point scale. This is what veterinarians use basically by examining the pet, physical exam, to see whether or not the dog has a weight problem or not. These dogs also had a sedentary lifestyle defined as not engaging in any habitual high-intensity activities, with daily walks being short or of mainly light intensity. Dogs were evaluated as being too fit and they were excluded. And by too fit, they mean that they were able to comfortably run at a speed of over 8 kilometers per hour on a 5% incline. Physical exam, blood work was otherwise normal. They were assigned to either the fitness group or the diet group based on owner preference, which is a problem, I think, with the study. Not that maybe it matters for the outcome, but to not randomly assort the dogs into both categories is weird to me. Dogs in the fitness group were exercised 3 times a week and the owners, and that was at the University of Copenhagen. At home, the owners were encouraged to exercise their dogs more if they wanted to, but they wanted them to increase the activity. Owners of the dogs in the diet group were instructed not to change the dog's activity, just let them do whatever they normally spontaneously do. So the diet they fed was a commercial, low-fat, high-protein, dry diet, which makes sense based on the human studies. The target weight loss was estimated on the basis of body condition score, where each unit of body condition score above ideal being 5 out of 9, was regarded as an equivalent to 10% being overweight. So for each point above 5 was at 10% over body weight, over ideal. The daily allowance was split into 2 feedings and then a portion used for treats. The aim was to achieve a weight loss rate of about 1 to 2% per week. So average 1.5% per week. The dogs were weighed every other week. And if weight loss was less than 1% or greater than 2%, then the dog's daily feeding was adjusted, so either increased or decreased by 10%. Okay, in regards to exercise, the general exercise protocol was 30 minutes on the underwater treadmill and 30 minutes on land-based treadmill. The water in the water treadmill was at the level of the stifle, so the knee, and a temperature of 25 degrees Celsius. That was the temperature of the water. The speed on the underwater treadmill was usually walking, so 35 to 65 meters per minute, with intervals of trotting or fast walking that went up to 115 meters per minute. On the land treadmill, they were at a steady trot at a 5% incline mixed with faster and slower intervals. During the first 2 weeks, exercise on the underwater treadmill was gradually increased from 10 minutes to 30 minutes. They did this so the dogs didn't get habituated to the exercise, because if you go to the gym or you work out pretty frequently or pretty consistently, your body gets used to whatever regimen you're doing, which is why people tend to switch it up. In terms of heart rate, for the incremental exercise test, the treadmill was set at 5% incline. Like we said, they were exercised for 5 minutes at each of 3 increments. And so they increased the increments, and they did so until the dog showed signs of fatigue. Body condition score was determined by veterinarians and were scanned by fan beam dual energy X-ray absorptiometry for body composition analysis. I'm familiar with this just from educational or from a literature standpoint, but I've never done this testing before. It seems like it requires general anesthesia, so this may not be the most practical thing, but it is considered the best way of figuring out body composition. Body composition was analyzed for lean body mass, fat mass, bone mineral content, and they used a computer software to analyze that. Results of the study. Fitness dogs, mean age of 7.6 years, whereas a diet dog, 6 years. Now, again, I wish they had standardized the dogs more into both groups to make them more equal. They didn't. And so, it may not matter for the study, or maybe it does matter for the results, but it would be nice to have them standardized. The mean daily energy intake on the basis of estimated target body weight was the same in both groups, and the mean protein was the same in both groups. Heart rate during the exercise. Heart rate was found to decrease significantly between the beginning and end of the study in both groups. So that the idea there was that if you are fit, your heart rate during exercise should lower, should become, your cardiovascular should be healthy, meaning less work for the heart if you're in a healthier state. And by less work, they presume less heart rate. Mean accelerometer counts during the intervention increase in the fitness group and decrease in the diet group, as expected. The mean percent increase in the fitness group was 13%, whereas the mean decrease in the diet group was 14%. So they increased and decreased by the same percentage, roughly, based on accelerometer, which makes sense. If you're making the fitness dogs move more, they're going to have higher accelerometry rates. And then finally, for weight loss and body composition, at the start of the intervention, the mean body weight was 33 kilograms for the fitness group and 39 kilograms for the diet group. These values decreased in both groups. So for the fitness group, it went down to 28 kilograms, and in the diet group, 34 kilograms. The mean percent weight loss was 13.9% for fitness group, 12.9% for the diet group. So about the same. For the fitness group, the body condition score median was 7 at the beginning of the study, 6 at the end of the study. And the diet group was similar. They started at 7.5 body condition score and went to 6. Weight loss was similar between groups, but the distribution of tissue loss differed between the groups, as lean body mass was lost in the diet group and preserved in the fitness group. So despite having both of them losing weight at pretty much the same rate, same total percentage, and having an improved body condition score, and having a lower heart rate, but all about the same, the lean body mass was the key difference that was preserved for the fitness group. When included age as a covariant, multiple linear regression analysis revealed that lean mass preservation was significantly better in fitness dogs compared to diet. Discussion. The observed loss of lean body mass in the diet group was in line with another study of pet dogs where they lost a lean body mass of about 15%. In that study, diet mean percent weight loss was 18%, and the mean rate of weight loss was 0.85% per week, which were comparable to the current study. Percent weight loss for the fitness group did not differ from the diet group, but lean body mass was preserved. That's the main finding in this study. In people, aerobic training or resistance training in weight loss programs preserves lean body mass, as you'd expect. An age-related reduction in muscle mass is called sarcopenia, is a phenomenon that has been studied in human medicine. Sarcopenia, once it is present, causes regeneration of muscle fiber to be slower and less pronounced. More active dogs can consume additional calories while achieving a weight loss similar to that of less active dogs. That makes sense because they're being active, so they can eat more but still lose weight. In our study, no difference in mean daily energy intake was detected between the groups. So even though the active dogs, the activity dogs were more active, they didn't seem to consume more calories. They do admit here that accelerometer counts are only a crude estimate of physical activity. A weight loss-induced reduction in a physical activity is well recognized from research in humans and is considered to be a biologically meaningful adaptation to preserve energy. One study found no change in dogs' physical activity during a 6-month weight loss program. So they're saying that if your dog loses weight, it doesn't make them become more active. Another study measured steps taken by dogs before and during weight loss programs that found pedometer counts remained constant, although owners were repeatedly encouraged to take their dogs on longer walks. The owners thought that the lack of owner compliance, rather than decreased voluntarily activity by the dogs, prevented increased physical activity. So there seems to be some debate there of whether or not if your dog loses weight, will they become more active or not? It seems kind of questionable that they will. It doesn't seem like they will. They also mention here that a gait change for the dogs to a smoother gait pattern following weight loss might reduce accelerometer output for the same activity, because it's been shown in people that a greater medial-lateral displacement of the body center of mass, so side to side, occurs in obese patients versus normal weight individuals during walking. So what they're saying here is that by virtue of the fact that these dogs are losing weight, it may change the way that their gait is, and that can affect the accelerometer measurements, and then of course mess up the study. Although accelerometry is a practical and affordable tool for activity monitoring in dogs, interpretation of the data is subject to speculation. We need more research. If physical training improved cardiorespiratory fitness in the fitness group, it was not achieved by the heart rate measurements because both the fit group and the diet group had a significant decrease in heart rate from the first to last test. Weight loss results in less strain on the cardiovascular system, hence the lower heart rate. Measurement of maximal oxygen consumption, which is VO2 max, is the gold standard for fitness assessment in people and experimental animals, but it was considered not practical and also unethical to do that for the study. And also they admit that a 12-week intervention period may have been a limiting factor. And that's the end of the study. And I would say the weaknesses of the study is the low number of dogs. They only studied, I think, 19 dogs for this, and that was divided between the two groups. 19 dogs. So it may have to have more dogs. I don't know what the magic number would be to make this more impactful study, but that's I would recommend. I also think that standardizing the dogs for each group and make them in randomized groups should also have been done. I think that 12 weeks is a good start, but maybe you want to assess like a year's worth of the differences between diet and fitness. And then finally, in terms of cardiovascular function, I don't know why they didn't measure things like blood pressure or do an electrocardiogram or an echocardiogram, other parameters of cardiovascular function. It may not be as good as the maximal oxygen consumption, the VO2 max, but it may give us at least more insight as far as the cardiovascular benefits of it. Because we know that with greyhounds, for example, they have a very low heart rate, right? And so clearly there is something to be said about heart rate as it relates to cardiovascular health in dogs. But it would have been nice if they dove a bit more deep into the cardiovascular functionality with other diagnostics. All right, folks, thank you so much for those who are watching, and we'll see you again tomorrow. Take care.